Okay. Good morning, everyone. So today we'll be discussing about one very interesting and very important topic in radiology. That is MSK radiology. Okay, we'll start off with some of the basic things about fracture. Then further on, we'll discuss about each site-specific things. Okay. So let's start off with which are the common vocabularies or terminologies that you'll encounter and usually that you'll hear in MSK radiology. So first one, these are all related to fractures. Okay. So the first one is a stress fracture. And the next one is a fatigue fracture. Third is a insufficiency fracture. And the next one, which you commonly hear, is a pathological fracture. And the next one is a open fracture. I'll tell you about one extra. It's a bonus fracture that you don't usually commonly hear, but it's very important. That is a tuft fracture. Tuft. Okay. So let's first see what a stress fracture is. Here, if you okay. Here actually these two, fatigue fracture and the insufficiency fracture, these actually are two types of stress fractures. Okay, and so what is a stress fracture? So let's see what a stress fracture is. Okay. So stress fracture, these are the fractures that usually happen when there is a mismatch. There is a mismatch between the strength of the bone and chronic stress. There's a mismatch between bone strength and chronic stress. So the important thing is it's chronic stress, not acute stress. Okay. So 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 either one of these things, either it is a bone strength or the chronic stress, one of these things will be abnormal. So in a fatigue fracture, from the name itself, you can understand there is some sort of fatigue of the bone. That fatigue comes in the bone. So actually here the bones are normal. The bones are normal here. But the stress is abnormal. There is abnormal amount of stress. So this will cause a fatigue fracture. What is an example of that? One commonly seen example is where the bone is normal, but there is abnormal stresses. Think about a very professional cross-country runner. Okay, these people run so much that they end up with fractures in their leg and foot. So that is one example of fatigue fracture. And in insufficiency fracture is the opposite of this. The bone is abnormal. Okay, there is abnormal bone here, and the stress is normal. Okay, one example is a commonly seen condition of osteoporosis. Okay, you hear an old lady walking down the stairs and she end up with fracture of her vertebral body. So here actually her bones are abnormal because of osteoporosis. Okay, and but the stress walking down stairs is a normal thing, but she ends up with fracture. So that is That's an example for insufficiency fracture. So these two are two types of stress fracture. Okay. And coming to pathological fracture, in pathological fractures, from the name itself, you know that it's a type of fracture that you see secondary to some sort of pathology of the bone. And most commonly, we see a lytic bone lesion. These fractures involve the lytic bone lesion and the bone. And which are the most common lytic bone lesion? One is aneurysmal bone cyst, simple bone cyst, and even METs. These are the most commonly seen lytic bone lesion that ends up with pathological fracture. Okay. And the next one is open fracture. In open fracture, what you normally see is these are always associated with some sort of open wound. Yeah, there will be open wound and they are exposed to the external environment. So these always, mostly always ends up in operation room, plus they give antibiotics. From the operation room, they do cleaning of the wound as well as internal reduction and reduction, whichever one that is. So the next one is a tough fracture. This is a bonus fracture. From the name, if anybody can guess, it's a fracture involving the fingers. Yeah, fingertip. It involves the fingertip. So the specialty or the important thing about tough fracture is these fractures are considered as open fractures. These are considered as open fracture if open fracture if the fracture involves the tough fracture, if the fracture involves a nail plate. Okay. So if the fracture involves the nail plate, these are considered as open fracture. And even though they don't end up in operation room, they'll mostly be given antibiotics. Okay. So